Hospitals in Fife, like elsewhere in the country just now, are incredibly busy. And there are a number of reasons why that's the case. But one of the biggest challenges in the winter is the number of viruses that tend to circulate, and that's absolutely true this year as well. It's a combination of influenza and COVID and RSV, as well as norovirus and streptococcal A. They're all circulating, and all of them can cause illness, especially to people who are vulnerable, so people who are older, and also to young children and people with underlying health conditions, but they can make everybody a bit miserable and under the weather. So what we're asking of you is to help us just now, and all of these are quite simple messages, but they're really important. And what we are fundamentally trying to do is protect those in our population who are more vulnerable from getting really unwell. And these messages are familiar. You've heard some of them before, particularly during COVID, but they're really important and still make a difference. So if you have symptoms of a respiratory virus, if you've got cold symptoms or flu symptoms or a sore throat or a cough in particular, please do everything you can to try not to pass it on to other people. And that means when you're touching your nose or your mouth, blowing your nose, wash your hands afterwards. Try to make sure when you've got cold symptoms that generally you're reducing the chance of infection and passing it on to other people by maintaining good hand hygiene. Try to stay away from large groups of people, and especially in indoor spaces, because that's where viruses spread most easily. If you can work from home when you've got symptoms to try to stop passing the virus on to your work colleagues, please do that. And also try to stay away from visiting places that are more vulnerable to infection, such as care homes and hospitals, until you feel better. Essentially, we're asking you to help us to help you. And thank you very much for listening.